I'm Clark Atkins, a cardiologist from North Carolina State University in the United States. And I've previously given you a session which reviewed the pathophysiology of heart failure very briefly, showed that many drugs which we use to treat heart failure have multiple applications affecting multiple things in this response to a falling cardiac output, and we talked about the mechanisms of action of these drugs. What we're going to do now in this session and the final session is apply those drugs to the treatment of common cardiovascular diseases in the dog. The first of these is the treatment of mitral regurgitation. And I'm going to review with you a new classification of heart disease put forth by the ACVIM consensus panel on mitral valvular disease. And then I'm going to review for you this ACVIM consensus statement on therapy. Mitral valvular disease is probably the most important cardiovascular disease in veterinary medicine. And it's particularly important because, as you can see from this chart showing you the incidence of mitral valvular disease in a one-year snapshot of cases seen at North Carolina State University, that it made up 68% of our cases. Second to this was heartworm infection. And in locales in which heartworm infection is not important, then mitral valvular insufficiency becomes relatively more important. In addition to the fact that the disease process is important in terms of numbers, it's important in terms of being life-threatening, and lastly, it's important because there's a large window of time from the moment in which we recognize a heart murmur until the animal dies. And during that large window of time, we have the potential to intervene either surgically or medically to slow the progression of the disease, or conceivably even to cure it. Today, we're going to talk about medical management of mitral valvular disease because surgical treatment is probably a ways off in the future as a practical therapy for dogs. So I'd like to begin the discussion on treatment of mitral valvular disease by reviewing the ACVIM consensus panel's report from 2009. The members of that consensus panel, configured by the ACVIM, were myself, John Bonagura, Steve Ettinger, Phil Fox, Sonia Gordon, Jens Hagstrom, Bob Hamlin, Bruce Keene, who was the chair of this committee, Virginia Louise Fuentes, and Rebecca Stepien. This panel represented various viewpoints on the management of heart failure and had representatives from both the United States and Europe. Consensus, as defined by this panel, meant that there had to be unanimous, 10 of the 10 participants, agreeing on a diagnostic or therapeutic approach. We also reported when there was a majority recommendation, meaning that 6 or more of the 10 participants felt that a treatment was appropriate. Our decision-making was based on the results of clinical trials, other published experimental evidence, anecdotal evidence, clinical experience, and finally expert opinion, listed in order of decreasing importance. This sort of panel will always tend to have an average approach, meaning that potential benefits clearly outweigh potential risks, so these therapies would not be thought of as cutting edge. I'd first like to share with you the classification system that was adapted by this group to come up with its recommendations. And this disease classification scheme was adapted from that put forth by the American College of Cardiology and the American Heart Association. And it divides the course of cardiac disease into multiple parts, starting with A, in which are animals that are at risk but have no signs of disease. That then would include, for example, a Cavalier King Charles Spaniel who had not yet developed a murmur. The second group, B, is divided into 2 parts. The first one, B1, recognizes animals that have a cardiac murmur due to mitral insufficiency, but no evidence of cardiac enlargement. As we move to B2, these dogs have both a murmur and radiographic or echocardiographic evidence of enlargement of the heart. A B1 and B2 are all asymptomatic. Group C includes dogs which have gone into heart failure. The first part of Group C are those dogs who are acutely affected and they're hospitalized for the acute management of heart failure. The second phase of Group C are animals which have heart failure or a history of heart failure but are being treated at home. And then finally, we have Group D dogs who are refractory cases. The first Group D dogs, shown as DA on this slide, are refractory and are hospitalized for their treatment. Chronic Group D dogs are those that are refractory to therapy but still can be managed at home. So we will go now into the specific recommendations of this panel for the treatment of mitral insufficiency.